Anytime.
Start with your name.
Did you want mine? Oh, Carrington, Carrington. Last name is Mason, Mason. There's a comma, then D period, O period, another comma, F period, A period, C period, S period.
All right.
And your exact title here?
I'm a urologist at Southwest Urology Associates.
And Dr. Mason, what causes prostate cancer?
Prostate cancer can come from several, let me start that over. Prostate cancer has several different causative factors. The first and foremost is probably genetics. Many forms of prostate cancer can be familial, and we see that certain populations have a higher incidence, such as the African American population.
Can prostate cancer be prevented?
I don't think prostate cancer can be completely prevented, but there's certain things that we can do to certainly lower our chances of having prostate cancer. Certainly, if we, I love the word certainly.
Just take your time.
Throw me the question again.
Can prostate cancer be prevented?
I don't believe prostate cancer can be prevented, but certainly there are things that we can do that will decrease the chances of getting prostate cancer. Eating a healthy diet with fresh fruits and vegetables, starting at an early age, diet, exercise, not being morbidly obese, avoiding fried foods, those will certainly be assistive in keeping you from getting prostate cancer, but I don't believe there's anything specifically we can do to guarantee it being prevented.
Is early detection of prostate cancer possible?
Early detection of prostate cancer is something that's very important despite many of the news articles we've seen lately to the contrary. Many men will be diagnosed with prostate cancer and saved from the progression of prostate cancer because of early screening, especially gentlemen who have family histories of prostate cancer or in the African American community. Those people need to start screening at the age of 40, and the routine population screening begins at the age of 50. The PSA blood test combined with a digital rectal examination can pick up most of the prostate cancers prior to an extensive form of the disease. That sounded like total bullshit.
No, it's okay. We're going to make you sound great.
Okay. Pitch that up one more time. I think there's a better little bit to get in that.
Is early detection of prostate cancer possible?
Despite what many media articles have presented over the last couple of years, prostate cancer screening really does prevent lives.
That's all right.
We're trying to prevent life. Despite what many articles to the contrary in popular media have shown lately, prostate cancer early detection is certainly now I'm all tickled up with all this. I just want ask me the question one more time. I got to think about dead puppies.
So is early detection of prostate cancer possible?
Early detection of prostate cancer is something that's been early detection of
Deep breath.
I've never been short of words in my entire life, but I'm trying to, there's been a great deal of controversy about this lately, and I'm trying to choose my words because I can be rather vehement at times, and I don't think that's the side that they want. Early detection of prostate cancer is facilitated through serum PSA blood testing as well as digital rectal examinations. These screening procedures should be instituted in men who are over 40 years of age in the African American community or those who have a first-degree relative with prostate cancer. By finding prostate cancer in the earlier stages, it's extremely curable and we can minimize the side effects of treatment.
Did you want to mention this last paragraph, something about 90% of all prostate cancers are found when the cancer is combined, and then 5-year survival rate is nearly 100%? Is that something?
Yeah, I think that data may be a bit, I'm not sure. I think using terms like many instead of giving hard and fast numbers, because it really has to do with the stage, the grade, there's a lot of different factors that go into that, and I think that's kind of too big a garbage can.
Okay, we'll go on to the next question then. Are some men more at risk for prostate cancer than others?
There are people who are at higher risk for prostate cancer. The men who have first-degree relatives with prostate cancer, and also gentlemen in the African American population are at greater risk for developing the disease than the average population.
So who should be tested for prostate cancer?
Prostate cancer screening and early detection should be instituted in gentlemen who are over the age of 40 with a first-degree relative. Okay. Early detection and prostate cancer screening should be utilized in gentlemen with first-degree relatives of prostate. I'm doing it again. I knew I should have brought down a bottle of water. Early detection and prostate cancer screening should be undertaken in gentlemen who are over the age of 40, have a first-degree relative with prostate cancer, or who are African American. In the routine population, not the routine population, patients who are, how do I put it? Patients who don't have African American heritage or no family member with prostate cancer begin their prostate cancer screening at age 50. Many of the screening protocols now will, in this over 50 no risk factor population, postpone screening for another 5 years with a normal finding.
There's been debate over whether or not men should even get screened for prostate cancer. From your perspective as a urologist, what are your thoughts?
The debate over prostate cancer screening is one that has been circulated mainly around economics. If you're the one patient who is the primary breadwinner in a family who has not been screened for prostate cancer, gets an advanced form of the disease and dies, you're leaving a lot more behind other than just what it costs for you to be treated. If you're that one individual who is suffering from prostate cancer, you've got a tremendous responsibility in your life, not only yourself but your family. The prostate cancer screening takes only a moment. The prostate cancer screening only takes a moment and is very minimally invasive and can give you some answers to prevent the progression of prostate cancer very easily.
And so what are the different ways to treat prostate cancer?
Prostate cancer has numerous forms of treatment, and these are all guided by the urologist with, actually, prostate cancer has many forms. Prostate cancer has many forms of therapy, but these are guided by the urologist after doing a formal assessment not only of the presence of the disease, but the stage and aggressiveness of it. Certainly, a long discussion is held with the patient and family to choose and tailor the proper therapy that's best for them given the stage and grade of the disease.
And Dr. Mason, you not only treat prostate cancer, but you've actually battled this disease. Can you tell us about your experience?
Well, I've been practicing urology at Methodist Medical Center since 1997, Funford. I've been practicing urology at Methodist Medical Center. I've been practicing urology at Methodist Medical Center since 1997, but in 2004, I too was diagnosed with prostate cancer. I have a first-degree family member that had an elevated PSA and was diagnosed with prostate cancer, and when my initial screening PSA came back elevated, I pursued diagnosis and biopsy at that time. Fortunately, I'm here 9 years later and living a happy, healthy life and taking care of patients with the additional perspective of not only knowing a little bit about prostate cancer and how to treat it, but also what it's like to be a patient.
Can prostate cancer be cured?
Prostate cancer is very curable when it's found in its earliest state. Prostate cancer is very curable when it's found in its earliest stages. Prostate cancer is very curable when it's found in its earliest stages. This illustrates the importance of early detection and screening.
Finally, let's talk about the Methodist Prostate Screening and Awareness Program. How do you see this service impacting the lives of men?
The Methodist hospital system chose over 10 years ago to invest in the community with the prostate cancer screening and awareness program. What has been done over the last, what has been done since what the program has done since it was initiated is discovered numerous people in the community who have not otherwise received the benefits of prostate cancer screening, information, and awareness, and their lives have been saved in a very simple and non-invasive diagnostic format.
That's all the questions I have.
That's good.
Anything in there that we can polish?
Yeah, it sounds great. And I was going to say, if there's anything else you would like to add that you would like to get out that we did not cover?
As a urologist and a prostate cancer survivor, I've had the pleasure of sharing my story with a number of people. And just on my block, I've had several people that have gone and found out they've had this disease, and without my having shared my story, this would have never done. I know for some people it's very uncomfortable to have their doctor sort of tell them about their own clinical experience, but for me, I've seen the benefit in the community. So I have to ask everybody I meet, what's your number? I think every guy needs to know, what's your PSA, what's your status in terms of your family history, and go and share that with your friends.
That was the most powerful.
Whenever you're ready.
Hello, my name is Timothy Upshaw, and that's TimothyUpshaw, and I am the manager of the Prostate Screening and Awareness Program for Methodist Health System.
How long has the Methodist Prostate Screening and Awareness Program been around?
Well, the program began in August of 2000, so we're now a 13-year-old program.
And since you started, how many men have you screened?
To date, 82,235 men have been screened through this program.
But that's not all you do, right?
No, in addition to the prostate blood test that we offer each man, we also check each man's cholesterol, good, bad, and total, their glucose, their triglycerides, and their blood pressure. Plus, we also do educational events where we go out and talk about the importance of getting screened.
Another great feature of your program is that you make it easier for men by taking your services out into the community, right?
Yes, that's correct. We provide screenings in places such as barbershops, rec centers, grocery stores, churches, wherever the men are, we take this screening to them.
And how important is getting screened for prostate cancer?
Well, according to the American Cancer Society, prostate cancer is the second leading cancer killer in this country. It's estimated in the state of Texas this year, over 11,300 men will be diagnosed with prostate cancer, and out of that number, about 3,000 men will lose their lives to this disease.
Is this something that every man should do?
Every man, if you're at that age where they recommend you get screened, and the screening age is for African American men is 40. For all other men, it's age 50, unless you have a family history of cancer, or if you don't know your history, then they say you should get screened at age 45.
And what are some of the biggest misperceptions about the actual screening process?
Well, when you talk about prostate screening, the first thing that men think about is that finger, which is the digital rectal exam. Each time I go out and do a screening event, men are more willing to do the prostate blood test part of the screening, but so many men are hesitant or reluctant to get the rectal exam. But you need to do both tests.
And what are some of the excuses you hear from men in putting off getting screened?
Well, I hear they either don't have the time, they're too busy, or if they got something, they don't want to know. I've heard guys say, well, I got to die from something. But then I tell them, why do you want to take a risk of dying from something that's treatable?
Is there a particular instance you remember where early detection saved someone's life?
Oh, we've had so many men that were diagnosed with prostate cancer through our screenings that are alive today. But I do know of a gentleman recently that we screened. He, at the time of his screening, said he felt fine. When his test was done, I got his results back, and I called him and told him that his prostate blood test was high. He followed up with the urologist, and he found out he had prostate cancer, and since then he's had the surgery, and he's doing great. So the screening has definitely saved his life.
this isn't one of the questions, but could you go over a little bit what you were saying earlier about what you do after going out in the community, the phone calls, and just talk about the process?
Okay. Each man that gets screened by us, when they get their results, or before they get their results, I get them the very next day from doing the screening. If their prostate blood test is high, I'll call them and I will tell them, it does not mean you have prostate cancer, but your prostate blood test is high and you need to follow up with a doctor to find out why it is high. It could be high for many different reasons. It could be high from a prostate infection, it could be high from an enlarged prostate, or it could just be high for no reason. But I call them and tell them, you need to follow up. A month after that initial call, I'll call them again to make sure that they followed up. If they have not, I will call them each month until they go to a doctor. If for some reason I can't reach them on the phone, I will drive to their homes, but I will follow up with every man until he goes to a doctor.
That's good. Any other questions?
No, that was all on the question sheet, but I just wanted, I wanted him, what he was saying earlier about that.
That's
That's so
good.
powerful.
Do you have anything else you'd like to add that we did not cover?
Well, I guess we covered everything. I mean, I don't think they necessarily need to know that this is the #1 prostate program in the country, but
Well,
Probably would be.
yeah, that would be a good thing. Set up straight for me.
Okay.
And let me. Can you cover that eye a little bit? Let her get that. That's at the very top. Yeah.
Oh, cover this.
Yeah, that's good right there. Okay. So just say that again about
Okay.
that. I guess you can. I mean, they don't have to use it, or we're not selecting what will be used, but Sarah and the people in the marketing PR office will decide what to use.
Okay.
So, but you may want to say that we're also proud that our program is, the #1, or however you want to say that.
Okay.
But say it right here.
Okay. This is an awesome program. I am happy to say that we are nationally recognized as the #1 hospital-based prostate program in the entire country. We've averaged about 40 prostate cancers per year through our screenings. And I'm also, again, happy to say that most of those men are still alive today. And a lot of them credit the fact that they got this screening at one of our locations is the reason why they're alive today. I had a letter that was mailed to me from one of the wives of one of the men that was screened by us, and she said that I saved her husband's life because he had a high prostate blood test. I called him up, I told him that it was high and that he should follow with a doctor, and I kept on him. I didn't let him get away from me. I called him every month. He went to the doctor and he found out he had prostate cancer, and now he has been treated for it and he is doing excellent. So, and she said that I saved her husband's life, and that's no greater feeling than knowing that you're making a difference in the lives of people. And that's what this program is about. This program was put here to save lives. And that's exactly what we're doing.
That was
Again, very
powerful.
powerful.
That made me tear up.
I know. I got
The
goosebumps.
It is,
letter.
I mean, when I got that letter, oh, it was,
Yeah.
I mean,
It's like it's worth, what you're doing is worthwhile, but when you see an actual, something that's sent
I
to
mean,
you.
yeah, and we've won awards, we've won national awards, we've won state awards, but that's not what it's about. It's about saving lives. And, and I know people tell me all the time, they say, you're really passionate about what you do. And I mean, I love my job. I love it. I work 6 days a week, sometimes 7, and I have no complaints. I thank the leaders here at this hospital. They're committed to the program. They believe in it. When years ago they could have decided, we've done enough with prostate, because they fund the program. The program is funded by the hospital. They could have decided years ago that, okay, we've done enough for prostate, because so many of these other hospitals are not doing screenings like we are. Years ago, just about every hospital, especially during the month of September, because it's prostate cancer month, June for Father's Day, they'll do screenings, but a lot of them aren't doing it now, and we're, for the most part, the only hospital in this area that's providing screenings, and yet we're still saving lives. I mean, we're finding the cancers. So, and that's what it's all about. When, like I said, this doctor who started the program, he was, a lot of people used to say he was my daddy. You know, he's my father because we had such a great relationship. He passed away earlier this year. And I used to always talk with him and tell him how the program was going, and he would always say that the program was so successful because of, you know, what I was doing, and I just told him I'm just doing what he taught me how to do and what I'm supposed to be doing. And I feel as though I'm doing exactly what I'm supposed to be doing in life. But if I could do anything different, I would like to head up a national program. I want, you know, the National Prostate Cancer Coalition has a program that travels around the country and do screenings. I want to head up that program. I want to be able to take this screening to places where it's not being taken, because we're a local program. I get calls from Fort Worth, from Houston, from Turl, wanting me to come and do a screening. We can't go that far because our desire is, as men need follow-up, they'll come to one of our hospitals. And if I go to Houston, you're not going to drive from Houston back to Oak Cliff to be seen by a doctor. You're going to be seen by a doctor locally. So, but I just wish I could screen even more men. I want the awareness for prostate cancer to be as big as breast cancer. You know, because you see so much in NFL and with baseball where they do the pink bats and the pink footballs and all that. But, you know, and men don't want to talk about prostate cancer. And that's why so many of us are dying from this disease, because we don't want to talk about it. And every man that I talk to, one of the questions I asked them, when was the last time you had a prostate blood test? And I tell them, if you can't come to one of my screenings, give me your address. I will come to your house and draw your blood. And I've done that before too, so.
Wow.
Yeah.
One thing I do want to ask though, because I know we already talked about the program going out into the communities. Now, is that a unique characteristic of this program? Or there are other programs that go out into the, like you said, the barber shops, the grocery stores, and places like that?
Well, there are other programs that go out to, like some of the events that I do. You'll have the diabetes program, and of course, mammogram, and some of these other programs. But as far as barber shops, we're pretty much the only ones in those barber shops. Grocery stores, we're at Jerry's Supermarket tomorrow.
Wow.
Right. As soon as you walk in the doors, you can see the Methodist table right there at the grocery store.
Well, your passion is catchy. I can really feel it kind of radiating off of you.
Translates.
So, yeah, it does. It reads really well. So
Thank you.
Thank you so much for your time and for your dedication to such an important program. And you're going to be you'll be on this with Mel Renfro. We did his interview last week. And
Yeah.
He was awesome.
Yeah, Mel's a great guy. Well, I went out to his house, I think, the day after y'all were there,
Yeah.
and because he signs things for me that I take out to events to promote the program. So.
Well, you know what I need to do is I probably will, you're the man I need to talk to. Or, let me see, are we?
Or that you're a prostate cancer survivor, however you want to refer to that.
Mel Renfro, 14 years with the Dallas Cowboys, and a 10-year prostate cancer survivor.
That was great. Could you say it one more time and say, hello, my name is Mel Renfro, and then say exactly what you just said. That was perfect.
Hello, my name is Mel Renfro, 14 years with the Dallas Cowboys, and a 10-year prostate cancer survivor.
That's perfect.
Can we say it one more time with the Super Bowls?
Sure.
Do you mind saying that with the Super Bowls?
2-time Super Bowl champion. Yeah. Whenever you're ready.
Hello, I'm Mel Renfro, 14 years with the Dallas Cowboys, 2-time Super Bowl champs. Well, let me start over.
That's okay.
Hello, I'm Mel Renfro, 14 years with the Dallas Cowboys, 2-time Super Bowl champs, and a 10-year prostate cancer survivor.
Wonderful, thank you. Can you talk a little bit about your prostate cancer experience? How did you find out that you had prostate cancer?
Well, it was kind of odd the way I found out. I went in for a routine doctor visit, and he did some blood work. And actually, I was out of town on the East Coast, and I got a phone call from the nurse in the doctor's office telling me that I needed to come in to see him, but there was nothing to worry about. My PSA was a little high. I think it was 4.1, but there was nothing to worry about but to come back to see him. But when I came back, they recommended that I go to a specialist. And I went to the specialist, and they did a culture. And unluckily, my test came back a Gleason's 9. And that was probably the worst type of prostate cancer that you could have, because 8 and 9 says it's gone into the lymph node, and just scared me to death. But I took all kind of x-rays and scans and found out that it did not penetrate the lymph gland, and it was all in the prostate. So we decided to do a radical and get rid of it once and for all.
Okay. From this experience, how has it affected the way that you care about putting the message out there about men knowing their PSA scores? And if you could maybe start that by saying, today I try to speak out about prostate cancer awareness because, and share a little bit along those lines.
Well, since this experience that I've had, it's important for me to let other men know how important it is just to do a simple test, a simple blood test. Any African American from 40 years on should have this done. You know, I've got sons that are about that age, and I certainly want them to check their prostates to make sure that they're cancer-free. Any chance I get to tell people about this, I do it because it's important. I've known some people that have passed away from prostate cancer because they just waited too long to get it checked. So every opportunity I get to talk about it, I do.
That's great. Do you want to wipe your
Yes.
cheek with that a little bit?
Yeah, I can feel it rolling down my face.
If at any point you feel like you need to stop to do that in between questions, we can do some splicing. So don't worry about that. So you've gotten involved with Methodist Dallas's prostate screening and awareness program. Could you comment a little bit about your involvement with that program and why it's important to you to support it?
Well, I've been working with Tim at Methodist for about 8 years now, and I've gone to different events with him. I've been on the radio with him talking about this, and just spreading the word and letting them know. And I am very serious about letting people know and getting the word out and the knowledge of just how important it is, because it's such a simple test and it can be done easily. So just you men out there, don't hesitate to do it.
That's great. If we could say something similar along those same lines, but mention the name of the program in there, the Prostate Screening and Awareness Program. Maybe even commenting on why you think it's an important program for Methodist to offer.
It's prostate screening.
Prostate Screening and Awareness Program. Or you can even just say their prostate screening program. You can refer to it to that as that easily, if it's more easy.
I've been working with Methodist in their prostate screening program for a long time now, and I think they do a wonderful job, and it's been real good working with them, and I'll continue to do whatever I can to support that program.
That's great. You mentioned that it's really important that men understand the importance of getting this screening done. What about your experience has made it so personal that you feel like this is something you personally need to stand behind and push? What has given you that ownership of it? Does that make sense?
Yeah. When I went to the doctor and found out that I had a Gleason's 9, I broke out into a cold sweat when I was told that usually it has left the prostate and gone into other parts of the body. And at that moment, I started thinking about my kids and my grandkids, because I didn't think I was going to survive. I mean, I thought it was just a matter of months before that I would not make it. But it it was fortunate, and and I thank God for it that I was able to have the radical and have the cancer removed. So it's life-threatening to not get it done. So it's real necessary, because if you don't get it done, you could possibly die. So that's why it's so important to me to let others know, with such a simple test, you could nip it in the bud and get rid of it and live a long life.
That's great. As you know, there's been a lot of controversy about prostate screening and whether men should get screened for it and whether they should even continue on with treatment, mostly because for certain people, they'll outlive the cancer. They'll die of something else before the cancer would, and seeking treatment might affect other aspects of their health. Can you comment on what you think is important just about being aware of your PSA score, whether or not you choose to act on treatment, whether or not it turns out to be cancer or not? Why do you think it's important for men to know what that score is?
Well, I've heard that it's slow growing, and sometimes men will die of something else before the prostate cancer, but you just never know. In my case, I was in my 60s, and I had no idea I had any problem at all. And within a few days or a few weeks, I learned that I had the most serious type of prostate cancer. And that's important. How did I go so long without finding out that it was there? Because I got the work done, quite often. So it's just important to, at least every 3 to 6 months, to get it checked, because you never know how serious it's going to be. And if you don't get it checked, you can end up in having a real serious case of the cancer.
Great. Could you say something along the line, are we okay on tape time?
Yep.
Okay. Could you say something along the lines of it being important for guys to be communicating with their physicians to find out when is the right time for them to get screened, and how frequently they should get screened, that's something that they need to work with their physician about?
Anytime you go to the doctor, you should always ask about your PSA and for a blood test to test the PSA. And if it comes back within the normal range, then I would say every 3 to 6 months that you should get it checked, because it can pop up at any time, and it's not a matter of if, it's just a matter of when. So be able to communicate with your doctor about this, and don't let it go a year or more without getting it checked. Every 3 to 6 months, and if you see that level rising, because it did with me after my cancer was gone, so you can go ahead and have it nipped in the bud and get rid of it. So it's just important for regular checks.
That's great.
Sorry.
Some standards say that, and depending on your risk, that you can wait longer to get screened. So we have something a little bit more general to be safe. Could you say something specifically like, it's important that guys talk to their doctors about when they should get screened and how often? Just something exactly like that, or along those lines.
It's very important that the guys communicate with their doctors. Sometimes a guy doesn't see a doctor for a year or two. That's not good. You should see your doctor regularly and communicate with your doctor regularly about getting your blood work checked to see if there's any area of your PSA rising or something different. But it's important to communicate. Just talk to your doctor. PSA is an easy thing to do, a simple blood test, and you get it checked.
Perfect. You're my hero right now. Since you've overcome cancer, has it affected the way you think about your health overall and being more proactive about it?
I think that particularly when you get above age 55, you're more conscious of every part of your body, and particularly as being a former athlete and a football player, which is a collision sport, you have things that happen with concussions and nerves and broken bones and hip replacements and knee replacements. So it's just very important to to be aware of your health, because you are getting older and your body's going in the other direction, so to say. So it's important that you maintain a good relationship with your doctor and keep tabs on your health in all areas, not only PSA, but in all areas of your health.
Fantastic. Thank you. I think I want to go back to the prostate screening awareness program for a second. I was wondering if you could comment a little bit about what you think are some great aspects about the program, that, you know, that the program goes to different locations to do screening for men, that we've reached that 80,000 man-mile mark. That's how many people we've screened since the program started. If you could just comment on some of those highlights.
I think the great thing about Methodist's screening awareness program is that they go out to the men. They send buses out. They send. They set up in churches. They set up in recreation centers. They have areas all around the city where men can come in or attend to get their PSA checked. And there's advertising to let you know. I know when I was more actively involved with Methodist, they had billboards up with my picture on them, giving addresses where men could go to get screened. So just be aware that those things are available and out there, and it's just a worthwhile thing that Methodist is doing, and to making people aware that they need to get their PSA checked.
Great. Is there a way to do this where the top of his head isn't cut off as much? I know people have pet peeves about that, and I'm just noticing that. Awesome. You're doing fantastic. We're almost done. And I had a question, and I lost it, and I didn't write it down. Oh, now I remember. You can think about it while he's finishing getting that ready. One of the things that we just did in our recent issues of Shine, we interviewed a lot of different men about different health conditions they've had and how they've kind of had to man up and step up and really take their health seriously because of those situations arising. And one of the ideas that came from that is, you know, if you're taking care of your health, you can be the man you want to be in other aspects of your life. Can you talk a little bit about overcoming that stereotype of going to the doctor isn't the manly thing to do, or what is the manly thing to do? What does it mean to be a real man when it comes to your wellness?
Well, that might be a little difficult for me to go over because I've got so many issues, and I guess I used to.
Oh, before you go on, can you wipe underneath your eyes and notice they're getting damp again? I know light's gonna pick that up. Fantastic. Like I said, I want you to look your best.
Yeah, when I reached age 55, until I reached age 55, I didn't think I could get sick. I didn't think I could be hurt, although I played football for such a long time. But after age 55, things started happening to me. My hip started going out, and I ended up having hip surgery. And I had some x-rays on my neck, and I've got some bone spurs and a lot of arthritis there. And just the past 2 years, I found out I've got spinal stenosis, and I'm going to have back surgery. So and I don't want to do it. I didn't want to have the hip surgery, but yeah, I had to do it. I mean, it got to where it was so painful that I had to have this hip surgery. And I don't want to have the back surgery, but I don't have good control of my legs because the bone's pinching the spine. So got to go in there and get that taken care of. And I'm going to get it done. So it's a matter of taking care of yourself. Going to your doctor and taking care of yourself, and don't try to take care of yourself, but let those that are able to do it, your doctors and physician, do their job to take care of you and fix you.
That's great. And you should get your back surgery done at Methodist Dallas because they have fantastic back surgeons. Seriously, like amazing doctors. We're videotaping someone later who just they removed like a tumor from her brain, and while she was 6 months pregnant. It's like amazing stories. So they're good doctors. Yeah. I can't think of anything else right now. Do you have anything that popped into your head? Is there anything that you want to add about the importance of getting screened, about?
No, not really. I think I've covered about as much as I can.
The only thing I was going to say is if he could address it, that because he's such a family man, how important the screening was, not just for him, but for his family, so that you can
Right.
have additional time with your family.
That would be great.
Well, it's very important to me because I've got a big family. I've got nine kids, 7 kids, and 9 grandkids, one on the way. And it's important that I take care of myself because I want to be around for them. And I'm sure they want that. So it's just very important to go to the doctor, get yourself taken care of, so you'll be around to see your kids grow up and they'll be able to enjoy their father and their grandfather.
That's great.
That was good.
I think so. I think we've got lots here. I'm trying to think. And you, okay, can you please introduce yourself?
My name is Alan Trumbley. I'm a medical oncologist here at Methodist Richardson Cancer Center, and
That's perfect.
Perfect.
You're fine.
okay.
Okay. Why do you think it's important for people to be aware of prostate cancer and knowing their PSA scores and things like that?
It's important for people to be aware of prostate cancer because prostate cancer is deadly, and just like any other cancer, I think screening for it and knowing about it is more important than not knowing and potentially waiting too long and it being metastatic or life-altering or life-limiting in any way. So I think it's important cancer for everyone to be aware of and know their own personal risk factors as well as their family history and PSA, etc., despite the controversies.
Okay.
Maybe too much.
That's okay. I think you're doing okay. Could you talk a little bit about what the risk factors are for prostate cancer?
Yeah, so the risk factors for prostate cancer are men, age, and there's risk factors of family history. There's inherited risk factors as well as just familial patterns. And so there's diet and geography as well. So where you're from plays a role in prostate cancer development.
Okay. Could you try doing that one more time? Just going through it. There was lots of ums in that one.
Gotcha.
So maybe we could try it with fewer.
Yeah. What was the question again?
Who is at risk for prostate cancer?
Okay. So risk factors for prostate cancer include male, sex. No, let me start that over again. The risk
Maybe
factors.
it's better to say it like men who are most at risk for prostate cancer.
There we go. I like that.
That might be better.
Females aren't. So, yeah, so men who are at risk for prostate cancer include older men. Age is a risk factor. Family history is very important in prostate cancer, as well as familial patterns. And so, I'm saying a lot of ums again, aren't I?
That's okay.
You're
So
okay.
do you have a list there that you are looking for me to say or
No,
anything really?
I just care about your expertise.
Okay. So just
Do you want me to?
geography, I mean Asian, African Americans are at higher risk, so I probably should include that as well.
So you've got race,
race.
age, what else?
I mean
Family history.
and probably diet as well.
Okay.
Um,
So
okay. Very good.
I'm gonna turn this so you can see the list and you can talk about each one as
Okay.
you're ready to talk about it.
Okay. So men that are at risk for prostate cancer are those that are older, men, so age over the age of 50, African American race, and family history of prostate cancer is very important.
Okay.
I still didn't do a very good job, did I?
You did.
You haven't done a bad job at all. I just want you to be comfortable.
Okay.
So it's okay. You're doing all right. Can you talk about who should get screened and at which points they should get screened for prostate cancer? And what I'm trying to get at there is, while someone with an average risk would get screened at age 50, American Cancer Society guidelines also recommend 40 and 45, depending on family history and race. So I'm hoping you can comment on,
Right.
kind of hit on those points.
So men who should be screened for prostate cancer, men who should be starting to get screened for prostate cancer typically should start at the age of 50 for average risk, according to the American Cancer Society. The men that are younger should consider it if they have higher risks, including family history, African American race. The men that are at higher risk should include PSA testing and discussions with their family physician.
Great. Why do you think men are wary of getting their prostate screening exam taken care of, and how would you encourage them to overcome those concerns or to move past them?
I think all men are weary of the exam because it includes a...
Okay, say that again and say wary instead of weary.
Ah,
There you go.
wary?
It's one of my common
Wary?
word pet peeves. Weary means tired, wary means afraid.
Ah, W-A-R-Y.
Yes. There you go.
Okay, so men are often wary of the prostate exam because of the delicate nature of the area that has to be examined. The location alone is very personal and difficult to get past. Why it's important is because it's life-altering. Prostate cancer can be deadly, and when that's discussed with patients and understood, the importance outweighs the personal discomfort.
Okay.
Does that make sense?
That was well said. That was
Okay.
really well said.
Very well said, yes. And
Wary.
I'm wondering, could you describe how a prostate cancer exam, what it exactly is? Because I think a lot of guys don't know it can just be a blood test. For some guys, it doesn't need to be.
So that's a good.
It doesn't need to be something very invasive,
Yeah.
basically. Or,
The methods of screening for a prostate exam include PSA, which is a simple blood test, which is prostate-specific antigen. The other important method for screening for prostate cancer is the digital rectal exam. This is a method of palpating the prostate from the rectum and feeling for abnormalities in the small gland that is just a finger length within the rectum. Yeah.
yeah.
Okay.
That was good.
Is that good enough? I'm
Yeah.
not sure if that was answered exactly what you
No, I
asked.
thought
but-
it did. That was good. Putting it in layman's terms, if you were talking with a guy right now and he was like, "There's no way I'm getting that test," what would you say to him to encourage him to be willing to get screened? Like, let's say it's like your best friend.
Right.
You're talking to him guy to guy.
I would tell him how do I rephrase that? So, if a man was, if a friend of mine was asking me if he needed to be screened for prostate cancer, I would tell him the importance of prostate cancer is found in 40 to 48% of men that are asymptomatic. And the earlier prostate cancer is found, the more likely the treatments are curable.
Okay.
Does that explain the importance enough?
Yes, although I think it doesn't sound like you talking to a friend.
I know.
It still sounds like you're talking to another doctor.
It's true.
You just use the word asymptomatic, like the average person isn't gonna know. So, like, how would you pare it down a little bit? Like,
Right.
dumb it
Dumb it down.
down. That's
No, I
probably not
understand.
the best way to say it, but
I understand. So, dude, you just got to get it checked because it may not be causing you problems, but it's there. Is that no? Is that too dumb? No. You want to find it before it, it does.
maybe somewhere in between. Something that's not gonna make me laugh out loud because we can't have my laughter on there.
Okay.
Okay.
I guess I'm still struggling how to paraphrase. I'm talking to a friend. Does that make sense?
Right. Maybe
I typically
maybe hitting on the importance of taking control of your health and how it's important to, that's
right.
That's what a guy does. A guy takes control, he mans up.
Right.
You don't have to say man up. That's my phrase, but
Yeah.
you can do it however you want.
I typically tell my patients and friends that they need to be screened for prostate cancer if they are at higher risk, and they need to have that conversation with their primary care doctor. They need to understand the importance based on their own risks, and just decide that that is something for your family and for your own sake to take care of.
Perfect. Perfect. Love it. That was great. We talked a little bit just passing yesterday about how you don't see lots of prostate cancer here.
Right.
But when you do finally see it,
It's advanced.
It's advanced.
Right.
Could you kind of comment on that a little bit? You know, that by the time an oncologist is usually seeing it, it's much later on because a guy hasn't taken care of things earlier on, and at that point it might be harder to treat, a lower, what's the rate I'm looking for? Success rate in treatment, I guess.
Right. So, as a medical oncologist, it's important that we find prostate cancer early. That way you don't have to see me. As a medical oncologist, I typically see advanced prostate cancer after it has already spread. At that point, once it's outside the prostate gland, it's typically incurable. And so treatments then become more,
You can start over if you want to.
So as a medical oncologist, I feel prostate cancer is very important to find early, because...
I'm sorry.
You're fine.
That's embarrassing.
That's a good way to say that, is encouraging them. One of the great things about being seen early
Is you won't have to see me.
Right.
And you will survive.
It's a
You're
minimal.
doing it perfectly, and I
Yeah.
messed it up with my phone.
No, it's fine. I should probably turn mine on vibrate too. Okay. Okay.
Gotta get in my position.
Yeah.
All right.
Okay.
There we go.
Remind me the question again. So
Talking about as a medical oncologist, by the time you're seeing prostate
it's too
cancer,
late. Right.
advocating for getting screened early.
Right.
It's most easily treatable.
So as a medical oncologist, I believe it's crucially important that patients be screened early. That way they don't have to come see me. Once the prostate cancer has spread and become metastatic, then chemotherapies and other therapies that are incurable become the only treatment options.
I don't, that's,
No.
You said the
I did-
therapies were incurable.
They are. I mean, metastatic prostate cancer is incurable.
The
I see,
cancers
but
that you
I
said-
see.
Yeah. So,
So are we ready to start again? Okay.
Yeah.
yeah.
So as a-
Maybe,
I'm kind of,
tell me if you think this is too, like, if this is not accurate. Is it possible to say, like there's a much slimmer chance of it being cured rather than completely incurable? I don't want to take hope away from it
Right.
completely, but at the same time, I want...
no, once it's metastatic, it's incurable.
Oh, it is? Okay. If it is, okay. And what does metastatic mean
It
exactly?
means it's spread. So once
Okay.
it's, so let me rethink this. So as a medical oncologist, I believe it's crucial that patients be screened early so that the prostate cancer can be caught early before it spreads. Once it spreads, it becomes much more difficult for us to cure the prostate cancer. Then the treatments become more focused on slowing prostate cancer's growth. If it's caught early, the treatments such as radiation or surgery can be curative, and you won't ever need to come see the medical oncologist.
Okay, great. That was perfect. See, that was awesome.
Okay.
You're great. Okay. Now that Methodist Richardson is part of Methodist Health System, the prostate screening and awareness program does outreach in this community and in this area. Can you comment on the program and what benefit you think it offers to men in the area?
The Methodist Richardson, should I say
It's not
Methodist?
Richardson,
No.
it's the Methodist Health System program.
Okay. The Methodist Health System outreach program for prostate screening is crucial from a community standpoint to raise the awareness of prostate cancer, as well as the limitations to prostate cancer treatments and screening. I believe just raising the awareness and education in the community is crucial to men's overall health and understanding of the disease process.
Great. That was great. Is there anything else you want to do it again?
I mean, I don't know if it was great, but I felt like
I feel like you're not relaxed.
I know.
Do you feel relaxed?
I feel like I could lean back and kick my feet up. I would be, but no, I'm okay. I'm okay.
I want you to be relaxed. Like
I'm good.
I feel like you're like giving
A little
me
nervous.
studio something. Okay,
It's
well,
my-
do it again then.
No, I'm okay.
Okay. Is there anything else that you would like to add about prostate cancer awareness? And guys, I may not have hit on everything
Yeah.
that you think is important. And
What else was in that article? Because I don't remember.
Mel's article?
Yeah, the one that.
Well, one of the things Mel advocates for is the early detection.
Yeah.
You know, screening, and that we've also talked with Tim, and you know Tim downtown. So we've talked to Tim, and the focus has always been on get it done early and get it done often.
Right.
And you might want to address that. in terms
Right.
of Screening. How often should a man? See, I did my screening a year ago, and
Yeah.
Tim said you need to come and do it again.
Right.
So you may want to address that part as well.
Right. Yeah, so screening for prostate cancer is crucial that it's done on a routine annual basis. In particular, if you have a family history, because the prostate cancer found early is much more curable than those that are found late after it's already spread.
That was great.
The limitations of screening for prostate cancer include a PSA being elevated that may not signify prostate cancer, and subsequent sequential screenings are very informative as well. So an abnormality in a PSA from year to year, stability shows importance, whereas a steady increase in PSA is concerning.
Okay, let's do that again. But maybe we're going to dumb it down a little bit again. So maybe like if you have a slightly raised PSA score 1 year, that may not be a big deal, but if you see it continually increasing, even by small amounts over the course of multiple years, then that raises the flag for us to.
Right.
So
So PSA is a controversial test. It can be elevated in men that don't have prostate cancer. So this raises the importance of us doing sequential annual exams or even more frequent exams in prostate cancer to get a baseline or to understand the stability of the test.
I don't think about that.
Still too. Okay.
Like this, so this video, imagine that like some guy's wife is going to be watching this video.
Yeah.
And she's got to be like, honey, you need to see this. You need to pay attention.
You need to do this every year and
Yeah.
not just think one time and you're done.
Right.
Exactly.
No, I
there
understand.
You go. That was great. Like, that was
Okay.
much more casual.
Down to earth, I understand. So prostate cancer is important that it is screened on a routine annual basis. Not only for the symptoms of prostate cancer, such as urinary retention and back pain, the other symptoms or the PSA test can be abnormal, and this can be monitored and followed up on and see what is a normal level for you. If it starts to change, then we can be look further into this.
That was much better.
Yeah.
Okay.
Good job.
Okay. I don't know. See, and then I included a little bit more. Yeah.
But that was good.
Okay.
No, that was good. Is there anything else that you would like to add? You know,
I think it is important, though, that, I mean, I kind of touched on it there at the end, though, that prostate cancer screening with a digital rectal exam is important, that there's symptomatic prostate cancer as well as non-symptomatic prostate cancer. So if you are having urinary retention symptoms, or if you're having back pain or other symptoms related to urinary or urine flow difficulties, it's important that those are considered as potential for prostate cancer.